Good afternoon. Kent Bottles here on the main line of Philadelphia, home of the Philadelphia Eagles and the Philadelphia Phillies. In the last video, we talked about we spend too much money on American healthcare and we don't really get high quality care for it. And we ended with a question, why does it matter? Well, it does matter because money that we spend on healthcare is money that's not available for other important things like education, energy development, defense, fire and police. So you name it, the federal budget includes all of those things. Now, Atal Gawande, the Harvard surgeon and New Yorker author, has been talking in commencement speeches to medical students and I think eloquently said why it matters. The idea that we can proceed oblivious to the economic conditions around us is folly. We in medicine have partly contributed to these troubles. Our country's health care is by far the most expensive in the world. The financial burden has damaged the global competitiveness of American businesses and bankrupted millions of families. It's devouring our government at every level, squeezing out investments in education, our infrastructure, energy development, and our future. Just one example. In 2007, 62.1% of personal bankruptcies were due to an illness in a family. And these weren't poor families or unemployed families. These were families that had health insurance, were homeowners, and had gone to college. As one of the authors put it, quote, "Unless you're Warren Buffett, your family's just one serious illness away from bankruptcy." So healthcare is also intimately connected to the United States budget deficit, the United States economic competitiveness in the global environment. How is healthcare causing the recession that we're all suffering from now? Well, we all know that healthcare premiums go up every year. When they go up, companies can't afford to give their employees as high a salary. When salaries stagnate, as they have been in the United States for quite a while, then just the regular American workers can't keep up with their car payments, their home payments, and just being able to send their kids to college. So what happened was consumers in America kept borrowing money over and over again. And in the year 26, it actually got to $14 trillion in consumer debt. And just after that, as we all know, in 2008, the recession hit. Why did the recession hit? Well, most people think it's because of the housing bubble and people couldn't afford their mortgages. That's what kind of set off the whole economic downturn that we're now experiencing. So consumers ran out of money, partly because their employers couldn't pay as much in their salaries because healthcare insurance kept going up year after year. So when consumers ran out of the money, they defaulted on their car loans, they defaulted on their home mortgages, and guess what? We now have a terrible, terrible economic downturn. You may not remember, but I learned in college economics that 70% of the American economy is based on consumer spending. So whether you buy a car, whether I buy a house, whether we spend a lot of money on clothes, makes a big difference in the economy. Now, we also know that by any indication, every growth indicator in healthcare is going down. Hospital admissions, surgical volumes, office visits, branded drug sales, they're all going down. So healthcare is no longer a growth industry. What Jeff Goldsmith has said, I actually agree with. He said, quote, "Providers are going to have to learn from Virginia Mason, ThedaCare, and Denver Health how to run lean and to make war on waste, both of time and resources. We won't have a choice. Providers will have to manage their expenses and service intensity in such a way that they break even on Medicare payments." Well, that's the end of this video, but next video we're going to talk about Medicare payments are going to go down. Then what? Please join me. And you can always find me at www.kentbottlesmd.com or on Twitter at @KentBottles. Until next time, from the main line of Philadelphia, see you next time.